Hi, my name is Kiley Haupt, and I'm in a group with Lauren, Hunter, and Ashleigh, and we are presenting to you the disease syphilis. Although the exact origin of syphilis is unknown, there are two different hypotheses. The first would be the Columbian theory. Syphilis was carried to Europe from the Americas by Christopher Columbus's voyage. This would take place in the 1400s, and this is where they started seeing a lot of different symptoms of syphilis. But there's also a second hypothesis that says that there was syphilis before Columbus went back to Europe from the Americas, but that it just went unrecognized. This is called the pre-Columbian theory. In different parts of Europe, there have been skeletons found and examined that have similar damage to the damage that would be caused by syphilis. Syphilis is a sexually transmitted disease, or an STD, that has 4 stages: primary, secondary, latent, and tertiary. Because syphilis is an STD, it is spread through intercourse between men and women, but also between two men. It is important to be screened often for STDs before those that are infected pass it on to their next partner. The second cause of syphilis is through congenital syphilis, which means that a mom that is pregnant that has syphilis can pass it on to her unborn baby. This is very unfortunate, and pregnant women should be tested for syphilis in their first prenatal appointment, which should be right off the bat once they find out that they're pregnant. Syphilis can cause miscarriages, stillborns, babies born with low birth weights, or like underweight babies, or babies that pass away shortly after birth. Babies that are born with syphilis can have deformed bones, severe anemia, enlarged livers or spleens. They can have more jaundice than most babies, the yellowing of their skin or their eyes. They can grow up to have brain and nerve problems like blindness or deafness. They can get meningitis or have skin rashes. Even scarier is that babies that are born with congenital syphilis don't always show these symptoms right after birth. Some symptoms show up later on, which can lead to a misdiagnosis or no diagnosis at all, which can lead to the death of the infant. Although my classmates will explain later what the prevention of syphilis is, it can be easily treated for pregnant mothers so that their babies don't have to be born with any of these birth defects or symptoms of syphilis, and should be detected early in their pregnancy.
All right, so now we're going to talk a little bit about the reservoirs of syphilis. Contrary to what some people may have heard, syphilis cannot be spread by using non-living objects that have come into contact with an infected person, such as eating utensils, swimming pools, bathtubs, doorknobs, and toilet seats. The only known reservoir of syphilis is the human body. All right, now we will be talking about the signs and symptoms of syphilis. Syphilis develops in 4 stages. Each stage presents itself with differing symptoms. The first stage is known as the primary stage. A defining symptom of this stage is the development of a chancre, which is a sore or ulcer that occurs at the site of the entry of the pathogen. The chancre is usually painless and develops within 10 to 90 days of the initial infection. These sores usually appear on the mouth, genitals, or anus. Lymph nodes may swell near the area of the chancre. Chancres will normally heal on their own within 3 to 6 weeks, and they may leave a scar. The next stage is the secondary stage. This stage is characterized by a rash that develops 2 to 12 weeks after the chancre develops. This rash usually appears on the palms of the hands and the soles of the feet. The rash usually consists of reddish-brown, small, flat, or raised skin sores. A rash might also develop on mucous membranes, in which it will appear as small open sores containing pus. The rash will take about 2 months to heal on its own. In this stage, syphilis has the potential to spread throughout the body, in which case the following symptoms might be present: a sore throat, hoarseness, patchy hair loss, especially in the eyebrows, eyelashes, and hair on the scalp, loss of appetite, weight loss, swollen glands, fatigue, headaches, and a fever. Now moving on to the final stages of syphilis. If syphilis is not treated, the next stage that will occur is the latent stage, also known as the hidden stage. This usually occurs about a year after the initial infection and can last between 3 to 20 years. Although symptoms are uncommon during this stage, relapses can occur, which cause a flare up of symptoms. The final stage of syphilis is the tertiary stage. This stage causes the most severe symptoms and, if left untreated, could lead to death. Symptoms at this stage are present due to complications that develop. These complications include gummata, which are growths of tissue that contain syphilis. They appear as nodules or ulcers and can turn into tumor-like masses. The common sites of gummata include the skin, where shallow open sores develop, mucous membranes, where gummas can become cancerous, the eyes, which can lead to blindness, and the respiratory system, which can lead to breathing problems. Another complication that can develop is cardiovascular syphilis. This occurs when the syphilis infection reaches the heart and blood vessels. As the infection progresses, it can become life-threatening and includes symptoms such as narrowing of the blood vessels that supply blood to the heart, which can lead to a heart attack and possible death. Neurosyphilis may also develop. This occurs because the syphilis bacteria has infected the brain and the spinal cord. When this develops, it leads to the destruction of the nervous system, which can lead to the various symptoms listed on this slide, ranging from memory loss and confusion to the inability to control urine and stool.
Hi there, my name's Hunter Perreira, and I'll be speaking with you today about the transmission and treatment of syphilis. Please note that I will not be reading directly from the slides, but I will be paraphrasing a lot of the information, so feel free to follow along when possible. The transmission of syphilis. Syphilis is an STD transmitted from person to person by direct contact with a syphilitic sore, known as a canker. Cankers can occur on or around the external genitals, in the vagina, around the anus, or in the rectum, or in or around the mouth. Transmission of syphilis can occur during vaginal, oral, or anal sex. In addition, pregnant women with syphilis can transmit the infection to their unborn child. The average time between acquisition of syphilis and the start of the first symptom is 21 days, but can range from 10 to 90 days. Please refer to the image on the transmission of syphilis slide. Here we see a mother in her final trimester of pregnancy. The green dots represent the mother's infected blood with syphilis being exposed to the fetus. This is the primary way that young unborn babies are exposed to syphilis. An infected mother may expose their baby to syphilis. Any pregnant woman with syphilis can transmit the disease to their baby during pregnancy via blood exposure. A pregnant woman should be tested at least once during her pregnancy for syphilis. They should feel free to contact their personal doctor or clinic for any other information. The treatment of syphilis. Penicillin G is the preferred drug for treating persons in all stages of syphilis. The preparation used, in example, benzathine, aqueous procaine, or aqueous crystalline, dosage and length of treatment depend on the stage and clinical manifestations of the disease. Treatment for latent syphilis and tertiary syphilis require a longer duration of therapy because organisms theoretically might be dividing more slowly. Unknown durations to ensure that those who did not acquire syphilis should be taken. Longer treatment durations should be required for persons with latent syphilis of unknown durations, with the preceding year are adequately treated. Clinical and serologic evaluation should be performed at 6 and 12 months after treatment. More frequent evaluation might be prudent if follow-up is uncertain or if repeat infection is a concern. Treatment will kill the syphilis bacterium and prevent further damage, but it will not repair damage already done. This is why the earlier you can catch the disease, the better. The present damages are permanent and will only grow worse if not contained and killed. Those with syphilis must abstain from sexual intercourse until their infection is eliminated. They must also inform any sexual partners who may have been exposed to syphilis.
Hello, my name is Lauren Perreira, and I'm going to be talking to you about the prevention of syphilis, and I'm also going to give you some additional information that I hope can be both helpful and also a little bit interesting to learn about, some fun facts about syphilis. First, I'm going to talk about prevention, and because syphilis is a sexually transmitted disease and sex is one of the #1 ways for you to contract it, I'm going to cover how to prevent yourself getting it sexually first. The really only sure way to prevent yourself from getting syphilis from having sex is to abstain from it completely, which obviously isn't the preferred method for most people. So besides completely abstaining from sex, the next best thing to do is practice safe sex. There are many different things involved in practicing safe sex, so I'll briefly cover each one before moving on. The first suggestion is to not have multiple partners. The more partners you have, the more likely you are to come into contact with somebody who has syphilis, so it's very important to be careful when choosing your partners. The next guideline is to always wear condoms during normal sex and also oral sex. Many people believe that the only purpose for condoms is birth control, and if there's some other form of birth control being used, then condoms aren't necessary. But condoms can provide much needed protection from not just syphilis, but all sexually transmitted diseases. And the third suggestion that I have for practicing safe sex would be to avoid using any kind of drugs or alcohol that would impair your judgment to the point that you aren't able to make smart decisions about your sexual partners. So I've talked about some ways to practice safe sex, so now I'll cover the rest of the suggestions I have for preventing the spread of syphilis. The first thing is getting tested periodically for syphilis and all other STDs, especially if you're having unprotected sex with multiple partners. Because the first stage of syphilis often goes unnoticed, it's very important to get tested and be aware of the things that could be going on inside your body. The next guideline is to stay away from used needles. This suggestion is mostly for people who choose to participate in IV drug use. This is a really common way besides sex or getting it, like pregnant mothers giving it to their babies, because it's a sure way for the person who has syphilis to basically completely inject the syphilis into the next person who uses that needle. So definitely avoid used needles, and hopefully most people who are using IV drugs will know this as well. And the final step for prevention that I'm going to talk about has already been talked about several times by other members of the group. And I think it's mostly just because this is really important and it's something that people should be educated about. But obviously women who have syphilis or think they might have syphilis and are either pregnant or are trying to get pregnant, they really need to consult their doctor immediately, because pregnant women giving it to their unborn children is also one of the most common ways for syphilis to be spread. So now I'll talk to you about the additional information that I mentioned earlier. This is just some interesting information about syphilis that is definitely helpful and useful to know, but it's also just really interesting, and I hope that the people watching will also think that this was interesting. The first thing is that individuals with HIV have highly increased chances of contracting syphilis because the wounds caused by HIV allow for easier contraction of syphilis. The opposite is also true, that contracting syphilis can make it easier for people to contract or give others HIV as well. The next one is that syphilis has been nicknamed the great imitator because its symptoms can be very similar to that of other diseases. And I think this really goes along with getting tested frequently to make sure that you're safe and that others are safe and that you know what's going on with your body, and you're being smart while making decisions about your sexual partners. The next fact is that in 2013 there were over 56,400 diagnosed cases of syphilis. Obviously that's a lot, so again, be smart and get tested. Let's try and get those numbers down now that we've talked about prevention. The next one is that the Mayo Clinic has reported that the number of cases among women is declining, while cases of men, specifically homosexual men, has been increasing. And the very last one that I'll share with you guys is that the southern states have more cases of syphilis than the northern states. So again, those were all pretty interesting and definitely useful information to know. That's going to wrap up our presentation, and I know on behalf of myself and the rest of the group that we want to thank you for watching, and we hope that the presentation was helpful and informative, and if you didn't know much about syphilis before, now you do. Thank you!